Welcome. In this video, we'll explore uveitic glaucoma, a complex eye condition that combines the challenges of uveitis and glaucoma. Understanding this disease is crucial for effective management and preserving vision. Uveitic glaucoma arises when uveitis, inflammation inside the eye, disrupts the normal flow of fluid. Common causes include autoimmune diseases like rheumatoid arthritis and ankylosing spondylitis, infections such as herpes simplex and toxoplasmosis, and even injury to the eye. Sometimes, the cause remains unknown, termed idiopathic uveitis. The connection between uveitis and glaucoma is intricate. Inflammation from uveitis can directly damage the trabecular meshwork, the eye's drainage system, hindering fluid outflow and raising intraocular pressure. Uveitis can also lead to the formation of scar tissue or synecdoche, further obstructing drainage pathways. Additionally, steroid medications, frequently used to treat uveitis, can themselves elevate intraocular pressure in some individuals. Uveitic glaucoma's exact prevalence is difficult to pinpoint, as it varies based on the prevalence of uveitis itself and the specific population studied. It is often more common in individuals with chronic or recurrent uveitis, particularly those with anterior uveitis. Studies suggest that a significant percentage of people with uveitis will develop glaucoma at some point. The symptoms of uveitic glaucoma can be a blend of those from both uveitis and glaucoma. Patients may experience eye pain, redness, blurred vision, light sensitivity, and halos around lights. It's important to note that in some cases, glaucoma can develop silently without noticeable symptoms, especially in chronic forms. Elevated intraocular pressure may or may not be symptomatic. Diagnosing uveitic glaucoma requires a comprehensive eye examination. This includes measuring intraocular pressure, assessing the drainage angle through gonioscopy, examining the optic nerve for signs of damage, and performing visual field testing to evaluate peripheral vision. Further investigations may involve imaging techniques like optical coherence tomography, or OCT, to analyze the optic nerve fibers, and blood tests to identify underlying systemic conditions that may be contributing to the uveitis. Uveitic glaucoma doesn't neatly fall into defined subtypes like open-angle or angle-closure glaucoma. However, it can be broadly categorized based on the mechanism of pressure elevation. These include open-angle glaucoma caused by trabeculitis, which is inflammation of the trabecular meshwork; angle-closure glaucoma from peripheral anterior synecdoche, where the iris adheres to the trabecular meshwork; and steroid-induced glaucoma due to long-term steroid use to treat the uveitis. Managing uveitic glaucoma is a multifaceted approach. The primary goals are to control both the uveitis and the glaucoma. Treatment options include topical and systemic corticosteroids to reduce inflammation, glaucoma medications to lower intraocular pressure, and in some cases, surgery. Surgical interventions may involve minimally invasive glaucoma surgery, or MGS, trabeculectomy to create a new drainage pathway, or even glaucoma drainage implants to bypass the obstructed outflow channels. Careful monitoring of intraocular pressure and inflammation is essential. Anti-VEGF therapy and local steroid injections can be useful in certain cases. Currently, there are no definitive ways to fully prevent uveitic glaucoma. However, early diagnosis and effective management of uveitis are crucial. Regular eye exams, especially for individuals with known risk factors like autoimmune diseases, are paramount. Adherence to prescribed medications and close collaboration with an ophthalmologist can help minimize the risk of developing uveitic glaucoma or slow its progression. The prognosis for uveitic glaucoma varies depending on several factors, including the severity and duration of the uveitis, the degree of glaucoma damage, and the individual's response to treatment. Early detection and aggressive management can significantly improve outcomes. Current research is focused on developing more targeted therapies for both uveitis and glaucoma, exploring novel drug delivery systems, and improving surgical techniques to preserve vision in patients with this challenging condition. Gene therapy and biological agents are future areas of research.